All right, awesome, you guys. So, done the neck, glenohumeral joint. Now we'll do this scapulothoracic joint, um, starting with elevation. So that's elevation, right? That's bilateral, unilateral. Um, this is one where you can kind of assess this. Could be a difficult assessment because if one of the cues for the neck or lateral flexion is the ear closer to the shoulder, and you might say in this case, yes, it is, but that's neck lateral flexion. Or is my ear closer to the shoulder? But it's easier, I guess you could say it's easier to assess when you're looking at the nose, aligned with the manubrium, so on and so forth. But anyway, just be aware of that. That can get confusing sometimes. This is a scapulothoracic joint that is stuck in elevation. Sorry, I lost my train of thought there. So in that case, I'm going to work on my upper trapezius, my levator scapula, and rhomboids. So rhomboid, and obviously unilateral right side. All right. So depression. Depression is this way. And so oftentimes I'll see depression and downward rotation of the scapula kind of mixed together. So that's something you might look for when you're doing this. But depression is pec minor. So when this is neutral shoulder, my shoulder's slightly depressed, I'm going to look at pec minor and I can feel that fire. Lower trap back here, and then serratus anterior here. All right, so those depress the shoulder blade. Those are the ones you're going to work on for that posture. Okay. Abduction, that's abduction of the scapula. This one's pretty easy, and like I said earlier, you might see some upward, some type of rotation of the scapula, and it gives you that feeling that you're abducted. So it could be both at the same time or one or the other. But for abduction, all you're going to do is look at your client from the posterior. I'm getting light here. Move my table over. So I'm in my treatment room. Look at their spine, and then look at the space between the medial border of the scapula and the spine. And then just look at both sides. Palpate if you need to. And if is one side further away from the spine than the other, then you're probably or abducted. And the muscles you need to work on for that is serratus anterior and pec minor for the scapula on that side. All right. So just remember, if the scapula medial border is further away, so if this was one scapula, that was the other one, this one would be considered abducted, and my spine's in the center. That was a pretty easy one, actually. Adduction or adduction, we're going back to the midline, back towards the spine. And again, you're going to assess by looking at both scapulas and seeing if the space between the medial border and the spine is less on one side or the other. So say I'm like that on one side and this on the other, that's the space. This would be considered adducted, right? And the muscles you want to work on for that is the middle trap and the rhomboids. Okay, middle trap and rhomboids. Posterior side. All right. This one's a little more tricky, but upward rotation, and like I was mentioning earlier, it can, upward rotation and perhaps abduction might be two things you work on for that scapula at the time. They kind of go together sometimes. And then downward rotation and adduction kind of work together too. So upward rotation, if my palms of my hands are my scapula, what will happen is the inferior angle, superior angle will not be aligned, and the scapula rotates up on the thorax or rib cage, and the humerus is coming up here. I know that's a weird way to demonstrate that. So upward rotation, spine's in between both of my hands, upward rotation, downward rotation, upward rotation, downward rotation. So when you're looking at upward rotation, Fred taught us to look at the inferior angle, and if it's slightly medial or lateral to the superior angle, then it's probably upwardly rotated. So superior angle of the scapula, inferior angle of scapula. If one goes this way like that, there's some upward rotation. All right, that's pretty easy to see that, and especially if you have the client, you can palpate and feel the angles, I should say. Okay. Muscles that you want to work on for upward rotation, that are stuck in that position, is the upper trapezius, the pec minor. Oh, sorry, not pec minor, my bad. It's the upper trapezius, serratus anterior, and the lower trap. Okay? Downward rotation. So if you see the inferior angle and the inferior angle, superior angle, and they're aligned vertically, or the inferior angle is more medial, and you might see a slope of the shoulder, or like, I don't know, okay, so there's kind of a neutral shoulder, and then if I do this, I'm not pulling back, which would be adduction, right? I'm just depressing that shoulder. That angle is like that. There's a good chance that that is a downward rotated scapula, and the inferior angle will be closer to the spine, thoracic spine. If you're going to work on those, you want to work on levator scapula, rhomboids, and pec minor. So rhomboids, pec minor, and levator scapula. All right. Hope that helps you guys. I'm going to do the movement stuff next. But anyway, have a good day.